Welcome back to the Pitchside Performance Podcast. Today we are joined by a special guest, Dr. Frankie Genoese, an assistant professor at the University of Wyoming and a leader in ACL rehab research. Dr. Genoese explores groundbreaking topics like fear and its impact on knee function post-ACL reconstruction, reaction time differences in contact versus non-contact ACL injuries, as well as goal setting and coping strategies in order to improve outcomes. This episode is packed with actionable insights to elevate ACL rehab. Let's dive in. All right, welcome back to the Pitchside Performance Podcast. We are extremely excited today to bring on another guest, Frankie Genoese.
Yep.
Did I get that right? Awesome.
Yep.
So yeah, before we get into our discussion, Frankie, just give us and the listeners a background of like who you are, and kind of your pathway to where you are now.
Absolutely. Yeah. Thank you guys so much for having me on. I'm really excited to be here. My name is Dr. Frankie Genoese. I am an assistant professor in the Division of Kinesiology and Health at the University of Wyoming. But my route to getting here took me a handful of different places. I actually got my Bachelor's of Science from James Madison University in athletic training. So I became a certified athletic trainer. I loved working with athletes, loved working in sport settings. And I also, during undergrad, really kind of had a draw to the psychological aspect of sport. And that was kind of my first interest in psychology and how that relates to sport and injury. And after that, I went on to get a master's at the University of Kentucky in post-professional athletic training. That was my first experience with research, and that gave me the opportunity to start looking at some psychological outcomes in patients with ACL reconstruction. And then after that, actually, during that time, I worked as a graduate assistant athletic trainer, actually at the largest high school in the state of Kentucky. So I was working with a lot of athletes in a somewhat rural setting, getting a lot of hands-on patient care. After that, I kind of had this interest in potentially pursuing a PhD, but I still loved working with athletes and wanted to continue down that road. So I took a athletic training position at an all-boys high school in the Denver, Colorado area. I worked there for a period of time providing sports medicine care for all of the boys sports teams. And then an opportunity presented itself to go to Michigan State University to pursue a PhD. So I did my PhD in kinesiology with a focus in athletic injury and rehabilitation at Michigan State, and then just graduated this past May, and now I am at the University of Wyoming.
Congratulations. Awesome.
Thank you. Thank
Yes,
you.
congratulations. Man,
Thanks.
that is quite the journey. That
It
is that
is.
is very awesome. So yeah, I mean, kind of going into like your main focus now with the research, which I know we'll get into a lot of it. But what really sparked your like initial interest with like ACLs? Like, did you suffer an ACL injury, or were you just kind of working as a clinician, seeing a lot of them? Like, how did that come about?
Yep, this is very personal to me because, like many female athletes, I tore my ACL when I was a sophomore in high school. And I did about a full 12 months of rehabilitation. I was a three-sport athlete. I tore it playing basketball. I missed the following softball season. I missed the following field hockey season. And that was a really, really tough time for me. And it wasn't just me. I saw my best friend tear hers not once, but twice. It was something that as a high school female athlete, you were kind of like, oh, this person tore their ACL and this person tore their ACL. And it just seemed like it was happening all the time. And so that was a personal experience for me. That really drove me to wanting to be an athletic trainer and to work with student athletes in that way. That was a time when I worked very closely with my athletic trainer, and I'm very grateful to have had one in our secondary school setting who was there every day. And I formed a great relationship with her. And that was the first time I really thought, I think I want to pursue this as a career. So that got me really interested in pursuing that clinical track. And then when I kind of started thinking about the psychological aspects of injury, and I was at the University of Kentucky, there was a PhD student doing some research at the time and was looking for some students to work with her. And she came into our class and said, I'm looking at psychological responses to ACL injury, if anybody is interested in doing this kind of work. And immediately I was like, yes, this is something that resonates with me because of my personal experiences, and not just physically, but I experienced a lot of injury related fear and anxiety and struggling to get back to sport and struggling with confidence and things of that nature. So those were all very close to me as an athlete. So this opportunity to explore those kinds of things in individuals with ACL reconstruction, I was immediately like, yes, I want to do this. She said, are you sure you don't want to go talk to other people? And I was like, nope, this is what I want to do. I already know that I'm passionate about this. So it's a mix of personal experiences and then also some really great professional experiences I've had working with athletes since then has kind of led me to this area.
That's really awesome. I think that especially from my point of view as well, from a clinical side, it's something like Elise already alluded to earlier. It's like it's often forgotten and not talked about, from the get-go. Like I feel like it's a huge missing link that, I'm excited for people like yourself and others that are really trying to push this needle forward of this area that needs to be addressed and, you know, really looked at and tracked across the whole time of the rehab process, because as we know, it's like it's not a straight linear process, like, and people experience it and process it in such different ways that being able to tailor it to that individual is just so critical. And from my point of view as a physical therapist, it's like I feel like a lot of us get so stuck into just thinking about we got to improve this physical capacity and this and that and quad, but then we got to also take a step back and, ask these questions and also just be able to kind of catch something and hopefully then provide that guidance of maybe some resources that are maybe outside of my scope of practice, but at least getting that individual what they need. So yeah,
Absolutely.
that's really awesome.
And it's amazing you touched on clinicians really being focused on physical outcomes, which is, of course, important and a main part of a clinician's job. But it's incredible how many of those psychological outcomes influence clinical outcomes and the relationship between the two. And so sometimes I feel like as clinicians, we may feel like I'm doing everything. I'm using all these different modalities. I'm trying all these different things, but I'm not seeing any improvements. And I think that's where it's important to kind of step back and say, is there something psychologically that may be going on? Have I talked to my patient about this? And do they feel like this is influencing their strength or functional outcomes, things of that nature?
Yeah, I completely agree. And I have found where like I've assessed this and evaluated it and been able to uh, you know, provide the resources and a referral essentially to another provider. And then all of a sudden it's like their physical stuff started to improve, which was a really cool experience. But
Yeah.
yeah, it's definitely something that is needed for sure. Um, so with that, what would you say is like the most exciting part of your research right now that you are diving into and seeing? I know you're involved in quite a bit, so I'm definitely gonna ask you more about like the visual motor stuff because I definitely want to get your thoughts on that. And I know Elisa will definitely dive into some of more of the psychological stuff that you're diving into as well.
Yeah. So I've had the opportunity to do some really cool things, kind of with an overarching theme of psychological responses and injury. And so I've explored, just like cognitive related outcomes, things like injury related fear or cognitive affective outcomes, pain catastrophizing. I've also had the opportunity to do some work looking at perceptual motor outcomes, things like visuomotor reaction time. And one of my last projects at Michigan State actually used the 360-degree immersive visualization room in the digital scholarship laboratory in the library, which a lot of people don't know is there, but it's this really cool cylindrical room that has floor to ceiling visual display and surround sound. So it essentially provides an immersive experience. But with that space, I essentially used that system to provide sport-specific visual and auditory distraction, and then looked at whether or not that affected injury-related outcomes like jump landing biomechanics, lower extremity visuomotor reaction time, just using that kind of immersive experience. And from there, I'm really interested in starting to use other forms of extended reality, so immersive virtual reality, and looking at things like exercise-based gaming or exergaming, and seeing if we can utilize some of these technology-driven interventions to assess outcomes, see if we can use them to improve outcomes. That was a kind of a cool, unique experience I had at Michigan State. During my PhD, I pursued a graduate certificate in serious game design and research. And so serious games are just games made or used for a purpose other than enjoyment. So improving health-related outcomes, for example, when we think of things like Wii Fit and all of those sports games when that came out and that was so new, they're fun, but they kind of had an underlying purpose to try to improve physical activity and health and whatnot. And so I'm really interested in exploring how we can use some of those things to potentially improve outcomes in patients with ACL injury. And I think that can both be physical outcomes and psychological outcomes, because a lot of those games also target things like motivation and can be used to improve adherence to rehabilitation and things of that nature. So that's a route I'm excited to start exploring now that I'm at the University of Wyoming and I'm starting my own research lab here. I think there are some really cool things that can be done with some of the technology that's coming out these days. And I think we'll start to see more of that in research and in sports medicine settings as that becomes more accessible.
That sounds really awesome.
I'm glad you think so. That's great.
Yeah, this is the stuff that I nerd out about for sure. Because I'm always trying to look at ways to improve patient outcomes and
Mhm.
definitely trying to find ways that, again, just go beyond just the physical aspect of just getting strong, right? So
Right.
I've
Yep.
I've been trying to dive down the rabbit hole of learning about how the brain and how we have to look at an ACL as almost like a brain injury, and trying to incorporate these strategies like virtual reality. I haven't really been good about like finding what's truly effective, but I would love to hear if you have any resources that like, because I've seen like the Google Cardboard, or like you can even buy goggles where you could slide the phone into where you can just have the patient doing like whether it's balancing, squatting, or just anything
Yep.
while you have virtual reality. But do you have any resources for like whether it's a YouTube page or a app or something to where there's like immersive experiences that you can have your patients do for
Yeah.
exercises?
Yeah, that's a great question. And you mentioned Google Cardboard and really accessible kind of extended reality alternatives that can be used in clinical settings. And I think those are great options, especially if you don't have access to virtual reality systems. They're becoming more affordable, but of course it depends on your resources. At some of the secondary schools I worked at, we could barely afford athletic tape. We would never in our lives put a virtual reality system in the budget. So it depends on your resources and what you have access to. But um, you know, I think right now I don't have any specific resources, and it's something I will definitely look into and follow up with you guys so that I can provide those for you if I find them. I think right now what I'm seeing in the literature is people are exploring a lot of different things. And because this area is so new, so right now I don't think you're seeing anything that is consistently being implemented in clinical settings that's showing an improvement in outcomes. People are using virtual reality to deliver mindfulness based interventions. People are using virtual reality to provide distraction to reduce pain. People are using virtual reality to um, improve motor skills. So it's being used in so many different ways and in so many different capacities. I think it depends what your goal is. What are you using it for? What are you trying to improve? I think that would really drive what kind of um, application you would want to use in that virtual reality setting or mixed reality setting. So I can definitely look up some potential resources and share those with you. But I think as clinicians, a big question is, what am I trying to address? And then kind of exploring from there, okay, what is being used to target these things when we think about these virtual reality applications?
Yeah, I would greatly appreciate that. And, I think I'm super jealous that you had access to that one room, that fully immersive room, because that sounds so cool. Because I think from the clinical side, I think that that's the biggest struggle from, when I look at return to play, which kind of will lead to my next question of like, what were some things that you were finding as far as visual motor reaction time differences from the involved side versus the uninvolved side or different tasks? But that's the hardest part is like, how can you create the true real game simulation in a clinic setting? And it's very difficult, and so when there's when I'm sure in that room you could probably control like the crowd, the weather, all these different things that obviously that would be incredible to have, but not all of us would be able to create that. So it's trying to find that bridge, and I feel like that's probably the hardest part with the full return to play is like, getting better at, how do we control practices into like the, minutes and all that type of stuff, but how can we get that earlier? And I think virtual reality is probably that bridge. So I'm really excited to see where this takes us moving forward. But yeah, so going into that, what would you say, like based off of what you've looked at, like what were you noticing for the visual motor reaction times, and what do you think are some of the factors at play there?
Yeah, and I just to go back to what you touched on, you essentially hit the exact reason that study came to life because I participated in what the MSU Graduate School called the Immersive Visualization Institute. And I was like, I don't know what this is, but it sounds really cool. We have the opportunity to explore using some immersive technology that the university has. It was a 2-day kind of institute, and I was like, let's do it. And I was introduced to that space, and I was sitting there and I was like, wait a second, this can be applied to my research. And they had nobody ever use it in a research capacity before. And from my thought process, you know, I approached it as, can we replicate some of those visual and attentional demands in sport settings that are really hard to replicate in a clinical setting? Because athletes most frequently conduct their rehabilitation process in a controlled clinical setting, but then they return to sport and they have 1,000 more attentional demands that they maybe have not experienced in that clinical setting. Things like changes in ambient noise level, having to perceive players on the field, having to interpret how players are moving, things of that nature. So that study was a very small first step in kind of trying to see, can we replicate some of these things? Because if so, can we use them from a training approach then to try to expose athletes to these things before they go back to sport? And especially when we think about ACL injuries, there's such a high risk of secondary injury. I think about 30% of individuals will have a secondary ACL injury within 24 months of return to sport. So thinking about, are there ways that we can improve that? And from the visuomotor reaction time area of my research kind of came about in a funny way. But when I was at the University of Kentucky, um, myself and the PhD student I was working with decided to create a lower extremity visuomotor reaction time assessment. There wasn't something out there. And you can use upper extremity neurocognitive assessments to look at neurocognitive function. But from our perspective, ACL injuries physically are a lower extremity injury, and a lot of patients have difficulties with lower extremity function. And so we wanted to create this lower extremity visuomotor reaction time test. So we created and developed this assessment, which they then did some reliability studies on, and it's now been adapted and used in other populations, which has been really neat to see. But part of my research at the University of Kentucky was essentially identifying a relationship between injury-related fear and visuomotor reaction time. And so we found that patients who had higher injury-related fear demonstrated slower lower extremity visuomotor reaction time. And thinking about that, it could potentially be a problem because if we have decreased coordination and things like that when we return to sport, does that then contribute to secondary injury risk in this population? And so we've continued to use that assessment, and we've found it to be associated with other outcomes like knee-related pain, as well as some other aspects of knee-related function. And so it's something that we're incorporating more into our work now, but that too is very new. And so a lot of those, and you, Zach, you were kind of talking about ACL injuries being a brain injury, which they are. And I think a lot of people don't fully understand some of the neuroplastic changes and alterations that can occur after an ACL injury. And so this area too is a little bit newer in regard to the world of ACL research and trying to explore some of these neurocognitive outcomes and seeing, are these changing after ACL reconstruction? Could these be contributing to secondary injury risk? I think that's a newer, in the research world, at least newer can be in the last 20 years. So I think that's kind of a newer area that we're starting to see some work be done in, is looking at these neurocognitive outcomes in patients with ACL reconstruction.
That's something that I'm actually seeing right now. So I'm just over a year post my second ACL surgery.
Okay.
And going to the rehab with Zach and, really learning how to jog, how to run, how to decelerate. Like for me as a sports performance coach, I know exactly how to do it. But then physically actually doing it and then reconnecting the brain to my body and especially my knee has been such a weird experience almost, where I'm like, I know exactly how to do it, but then my knee is not reacting, my muscles are not reacting the way that my brain knows how to. So that's why I think it's such a cool research area to further dive deep into, okay, what is actually happening in our brain that changes that connection? And then how can we help rebuild that connection, or how can we help our athletes relearn certain movement pattern and strategies without compensating? Because I know when I was learning how to decelerate, change of direction, I sent videos to Zach and I'm like, I don't know why I'm doing this.
Yep.
But it's just happening. I've been working with a lot of athletes, and my goal is obviously always to not have ACLs, but we can't prevent ACL injuries. I think how frequent they do happen, and especially in female athletes. We've been dealing so much with them on the strength side, but a lot of it is working on that, not only technique, but then also that cognitive side. I love creating drills where I have different stimuluses involved, whether it's like colors or reaction, visual, auditory cues, and creating all these different stimulus. And with that too, it's we get comfortable, doing what we know. And our athletes get comfortable with that. They're like, oh yeah, I'm excelling at this drill. But then we put them out into the training, the team training, and all of a sudden everything breaks down. Yep. And I think that is such an important part that still gets overlooked. And having people like you, Frankie, that dive deep into it now can actually show why this matters or how it actually affects our athletes is such a tremendous work.
Yeah, thank you. I appreciate that. It's something, it's, and being a female athlete who's experienced it, it's something you become passionate about because of experiences that you've had. And working as a clinician, seeing the experiences of my athletes and seeing athletes lose college scholarship after college scholarship because of ACL injuries and things of that nature. It really, I feel fortunate to be able to do work in this area because it means a lot to me, individually and also as a professional.
Yeah, I mean, that's how I got into sports performance. I had
And
an ACL, I had wonderful coaches who helped me through. I'm like, this is it. This is what I want to do.
and I think
Um,
that's how most of us get into
yeah,
this field. A lot of us joked in my old research laboratory at Michigan State, like you had to have an ACL tear to work in the lab. Otherwise, you were out. You didn't know what it was like. But funny enough, our lab director had never torn her ACL, but all of her students had. So we all had personal experiences. So I frequently joke it's like a rite of passage. But I think that's what gets a lot of us into this area of work because we become
yes.
passionate about it.
Absolutely. And speaking of which, so over the time, I really got passionate about the mental side because
Mhm.
we do, like Zach said, like you said, we always focus on the physical side of rehab, and oftentimes it gets overlooked. And we may send our athletes over to sport counseling or whatever. I've been fortunate enough to have experienced that myself. When I did my first ACL back in college, we've had a wonderful sports psychologist on our staff, and I was blessed enough with her to learn a lot of coping mechanisms and how to overcome that fear of injury, fear of re-injury. But could you dive a little more into how your research connects that ACL injury and anxiety of or fear of return to play, and kind of a little bit more on like what are some other maybe aspects along the anxiety spectrum continuum that you see when it comes to return to play?
Yeah, absolutely. So my as I mentioned a little bit, I kind of started out in this area of injury related fear and have continued to explore a lot of different psychological outcomes in patients with ACL reconstruction. But injury related fear has really come on as a very significant one because I think about 1 in 3 athletes or individuals with ACL reconstruction won't return to their previous level of physical activity. And injury related fear is frequently reported as one of these primary barriers to returning to that pre-injury level of sport. And so we're seeing it affect return to sport. It's now been found to be associated with secondary injury risk. So now we're also seeing it tied to secondary injury risk in this population. And we also see it tied to all kinds of physical outcomes as well. So there's been a lot of attention in this area of injury related fear. And that's something that I experienced as an athlete. And I will be open in saying I'm still very physically active. And there are still things that I'm like, nope, I don't want to do that. I don't feel comfortable. I don't feel confident. And that's with me still being in this line of work for X number of years. But so it's something that's very, very prevalent, and you can return to sport and be successful and not have a secondary injury risk, but you can still experience injury related fear. Um, so we see that a lot in patients with ACL reconstruction. And Zach, you made a great comment earlier about kind of psychological recovery not being a linear trajectory. And it absolutely isn't. But I think sometimes that's what a lot of people expect. I'm 9 months post-op. I got cleared for return to sport. I should be at my peak. Why do I feel anxious? Why am I nervous? Why do I feel hesitant about diving on the ground in soccer? Things of that nature. And for a while, people kind of thought psychological responses to injury followed a linear trajectory like the grief model and grieving death. And then as we looked further and further into this, they're saying it absolutely isn't. You can experience all kinds of things in a lot of different orders. You can regress, you can skip certain responses that other people may experience. And in this population, we almost kind of see like a bell shape. We see, or an inverse at that, right? But we see kind of high injury-related fear after surgery. And then halfway through that rehabilitation process, when people are starting to run again and they're starting to jump and they're feeling more confident, we kind of see a decrease in that injury-related fear. And then commonly it actually then increases around return to sport. So it looks very different for everybody, but how individuals cope with their injuries, like you touched on, Eliza, that can influence psychological outcomes and physical outcomes. And so everybody copes differently, and how an individual copes with an injury varies because it can depend, what did that sport mean to that individual? Was that their entire social support system? Was that where they found relaxation? Did that bring them happiness? So without that, have they lost their social support system? You know, have they kind of lost this big thing in their life, and how do they cope with that? You have people that may have very positive outlooks and who use active coping strategies to kind of try to navigate the problem at hand. And so maybe they're seeking help and education from their medical providers to educate themselves and see what they can do to manage throughout the rehabilitation process. Maybe they're using active coping strategies like goal setting. You can also have individuals who pursue more emotion focused coping, where they're just trying to manage the emotional effects of that injury. Are they engaging in avoidance strategies and in avoiding the problem? Are they minimizing the problem? Things of that nature. And so it can very much depend on the athlete, what resources they have. But some of those then drive behavioral aspects after injury, other emotional aspects after injury. So a lot of those things are related. And as a clinician, I think we don't always think about how an individual copes with injury and how that may influence the rehabilitation process. But even coping can affect their rehabilitation adherence and whether or not they're coming to rehab, which would, of course, then influence their physical outcomes and their recovery process. And so sometimes talking to athletes, I think, can be beneficial, and having a conversation about how they're coping with that. Because especially when I think about the setting that I worked in and working with secondary school student athletes, a lot of them, especially my younger kids, probably wouldn't even know what I meant if I said, "What coping strategies do you have?" They'd probably look at me and be like, "What are you talking about?" And so having conversations about that, I think, can be really helpful, because you may have to help an individual identify active coping strategies or coping mechanisms that could be helpful in that recovery process.
That is super informative, absolutely mind-blowing. Zach and I, we've always talked about the importance of a holistic support staff. And you mentioned that, some athletes are fortunate enough to have that, but there are also a lot of athletes who, lose that support system, or it's very individualized. And it's something that I noticed to work with my athletes. It always has to be a communication between me and the athletic trainer or PT, parents, teammates. And I think what you just mentioned, that just sums it up, where athletes need someone to talk to, I think, right? And I think that's how we can help athletes. And I don't need to be an expert, but I can ask, but hey, how are you doing? And that can sometimes go a really long way. And then if we go down the path where I feel like I don't feel, that is my area of expertise anymore, I can refer them to experts like sports psychologists, sport counseling, athletic trainers who might have a little deeper understanding and knowledge of the certain areas that affect that part of recovery, right?
Absolutely. Yeah. And I think you touch on a great point, because a lot of times, and athletic trainers frequently fill this role, because we are with patients a lot. And we are especially in patients during this very difficult time where they have essentially lost a big part of their lives when we think about sport. And if it's an injury such as an ACL injury, where you're out for 9 months, we spend a lot of time with that patient and they end up confiding in their athletic trainer a lot. But if they have other support staff like strength and conditioning coaches, sports psychologists, utilizing that support staff can be really helpful. And if they ask for guidance or they ask for education on something that may not be your area of expertise, still just being able to provide them the resources or direct them to the individual that can help them is still beneficial. You don't have to be the person that knows everything. And sometimes that's difficult. And as an athletic trainer, sometimes it would feel like I'm failing my patients if I don't know everything, but it's impossible to know everything, right? And so utilizing your system and still just helping them find the right person, directing them to the right person is helpful in assisting them still.
Well, thank you for kind of explaining that one step. It kind of ties into the next question that I have on like, how can we as, I don't want to say not expert, but I'm not an expert in the field of psychology. So how can someone like me or a PT, a parent, even or a coach help set realistic goals for the return to play while maybe also managing other related issues, whether it's fear, anxiety, I know depression can be a big one too in ACL injuries.
Yeah, absolutely. First off, I love that you're asking about goal setting at all. I think it's really important, and I think it seems like something that is so simple. And for clinicians, it's this kind of basic skill that we learn. And as a clinician, you're essentially always setting goals because we're always trying to progress patients to a certain level of function. But it really, really is beneficial. And I think you used a perfect word when you asked the question because you said set realistic goals. And I think that is a really important piece of the puzzle. Because when we think about injured athletes, if you ask them, what's your primary goal? They're probably going to say, I want to get back to playing my sport, or I want to get back to starting on this team, or whatever it may be. And it's this really big outcome goal. And so as a clinician or a provider working with these patients, I think stepping back and looking at, okay, this is our big goal. How can we set smaller, realistic goals that will help us achieve that big goal? And sometimes that's hard for an athlete because they may not understand the physical aspects of rehabilitation that are important to get back to that big goal. They probably don't know that they should have 90% symmetry and quad strength. And that may not make sense to them. So I think part of it is an educational process. So educating patients on kind of the reality of the recovery process, what that commonly looks like, what that could look like, being realistic about potential setbacks and setbacks being okay, but having a plan for if there is a setback is also really helpful. And so I think by setting those smaller goals as patients achieve them, that will sometimes help with the psychological side of things a little bit, depending what it is. But a lot of times as we set smaller goals, it helps increase confidence. It helps increase motivation. And so that can be helpful if an athlete's saying, okay, I now know that I can do this and I'm feeling really confident about doing this next thing. And so I think it's just important to make it a collaborative process. So making sure that it's a conversation between you and the patient. And, sometimes, like I said, they may not understand all the physical goals we may have in regard to achieving functional recovery. But kind of combining goals. So maybe you set some for them and then they set some as well. So that collaborative process is important, and having them involved in that process is important. And I think with the when we think about the psychological side, and you mentioned depression, we see, I think it's about 25% of patients have long-term symptoms of anxiety and depression post ACL reconstruction. So these are things that are present throughout the rehabilitation process and even after return to sport. And, you know, like I said, sometimes setting goals can be helpful when navigating some of those psychological responses. But it can also be possible to set some like mental health related goals as well. So, what strategies can we use to improve confidence? What strategies can we use to decrease injury related fear? Things like that. So maybe our goal isn't just 90% quad symmetry strength, but maybe we're targeting some of those psychological outcomes as well. And I think you mentioned earlier a great comment about a holistic approach to healthcare. And I think that's really important. And you mentioned kind of multiple providers and having a team of support. Conversations within that team are important as well. So if you are a clinician or somebody who has access and collaborates with a strength and conditioning staff, or your orthopedic surgeons, or a team physician, having open lines of communication can be really beneficial as the clinician, but also for the athlete if they're kind of getting this holistic approach to care from multiple individuals in their support system.
I always like to think of it as like an athlete-centered approach.
Yep.
And I know I'm from Germany originally, but in the US, it's a lot of times it's a coach-centered approach, or make it a clinician-centered approach. It's like, this is what I need you to do, but the athlete may not be ready to do that, right? We're pressing something onto them that they are not maybe physically, but also maybe mentally not able to do. So I really like that you pointed that out, that it's so important to have everyone involved, but then also the individual parties communicating as well. One thing that I'm actually really interested in is, do you find certain populations responding differently to certain coping mechanisms? And is there any certain group that's maybe more prevalent to anxiety and fear return to play? So I'm thinking female versus male athletes. I'm thinking maybe different sports, or high school versus college, maturity can maybe play a role, or even elite athletes versus recreational athletes.
Yeah, that's a great question. And I think in patients with ACL reconstruction, at least, I think females are like twice as likely to have a depression or anxiety diagnosis, or prevalence of anxiety or depression post surgery, which in an ACL reconstruction population, we see a lot of differences between males and females post surgery, as well as some differences pre-ACL injury that contributes to the risk of ACL injury. But we see a lot of deficits in that post-surgery timeframe too. Physical things such as strength, but then also some of these psychological things. And I think in regard to kind of level of sport, I haven't explored that area as much in regard to recreational versus elite. I think there are a lot of things that could contribute to that. If you have a recreational athlete who is participating in, let's say, a soccer league for fun with their friends, and they tear their ACL, they may not feel as much pressure to return to that setting. They may not feel as fearful, and maybe they don't plan on playing recreational soccer again because they have other priorities that are more important. Whereas if you have a elite level athlete and that is their job, there's probably more pressure to return to the same level that they were at to keep their starting position on that team. So I think some kind of external factors can influence some of those responses. But then I also think when you look at it like that, those individuals probably also have different support systems. Elite level athlete probably has an entire healthcare team that they're working with on a daily basis, multiple times a day. And that may improve their confidence and may decrease their injury related fear. Whereas if you have somebody participating in recreational sport, they may just see a physical therapist once or twice a week for a couple months. Their insurance runs out and they may not have that system. So if they do want to return to sport and they don't have those resources, maybe that individual has increased injury related fear. So I think there are a lot of other things that can kind of play into how individuals respond to injury, environmental factors, social factors, previous history of injury. If somebody has had a previous injury and they had a great rehabilitation experience, they recovered tremendously well, they returned to sport and had no issues, they're probably going to feel more optimistic about that process when they get injured again. Whereas if you have somebody who had a terrible recovery experience. They had setback after setback after setback. They had a lot of pain upon return to sport. They weren't playing at the same level. Didn't have any confidence, and they get hurt again. That may then influence how they approach that recovery process the second time. So there are a lot of things that I think can influence that, and that is it's one of the fun but challenging things about doing this area of work, because unlike a fracture that has, you'll heal in X number of weeks and you should be good to go, every person responds to injury differently because there are so many of those factors that influence how they perceive that injury and the recovery process. So that's why it's not this perfect linear trajectory of recovery, and we can have setbacks, and there are just so many things that play into it. So that's why as clinicians in this area, we really push an individualized treatment approach. It's treating the individual, not the injury, because there's so many more things that are contributing to this patient's experience and recovery than just that injury.
Yeah, I completely agree. And I really like that you brought up the idea of the setbacks. And I try to really highlight that at the beginning, especially if I have them maybe even before surgery or just like first visit, after the surgery. It's like laying that out there and just like, it's not about if, it's like when,
Yep.
when you will have a setback, and it's completely normal and that's okay. And I like to draw the linear line and then draw the squiggle about
Yep.
this is what it actually looks like. I think that's one of my favorite things to draw for people, just to let them know that it is okay. And
Absolutely.
that it's not like you're doing anything wrong per se, but it's just maybe we have to take a step back and modify things, but it's like, I think that they at least know going in, like, hey, if this does happen, it is okay. I'm not, doing anything bad. It's just that it's part of the process.
And
And
that's
yeah, go
so
ahead.
important because for and I've worked with patients where, they've said, well, my surgeon never told me this. I didn't know that my quad would still be this weak. I didn't know that I'd be feeling this way. I didn't know that I may still have pain. And that's why I think that's a fantastic approach is really educating the patient from the beginning about, that these are things that we sometimes see. This is totally okay. This isn't abnormal. This doesn't mean that you're not recovering well. These are just things that may happen. Because another thing that I think is hard, especially when I think about working with secondary school student athletes, they see professional athletes on TV that are returning from ACL reconstruction in 6 months or something of that nature, and kind of these really accelerated timelines. But those individuals have tremendously different resources when compared to a secondary school student athlete. And that is their job. They're in rehabilitation for hours and hours a day. And, but then when they start to think that that's what's normal, and then they're at 7 months post reconstruction and they're still having deficits in XYZ and they aren't getting cleared for return to sport, when they think that's normal, then they're upset and they're discouraged and they feel like something's wrong. And so I think that's a fantastic approach, just having those conversations with patients at the beginning of a rehabilitation process or pre-surgery if it's a surgical procedure, so that they can have realistic expectations throughout that process. And also continuing to have those conversations throughout is important, not really making it a one and done, like, okay, this is what might happen, but continuously engaging in those educational conversations, I think can really help patients throughout that recovery process then. So I love that you touched on that.
Yeah, and I think that that's the hardest part about my my position is protocols and
Yes.
time-based criteria, or not criteria, time-based protocols versus criterion-based protocols.
Yep.
And that's something that like kind of like what Elisa touched on is like, the athlete center approach and having all team members collaborative and all on the same page is obviously the first category. If you have a surgeon telling you 6 months, your PT's telling you 12
Yes.
months, athletic
Yep.
trainers telling you 11 months, it's like it's all over the place. And then going to your point of like, I have seen this happen on so many occasions where I sound like the bad guy because I'm like,
Yep.
I'm very specific. I go criteria. I'm like, this is your protocol, but it's not for everybody. It's like we use it as a guide, but here are the things that you need to check off for
Mhm.
you to get to this phase or whatever it is. But that's where it's hard because a surgeon may tell you one thing, and then it's like, here's 6 months. Your surgeon said you'd be back. And then I'm like, you still have a few months. And then again, from the psychological aspect, that's very challenging. And you feel like you're failing at
Yep.
that point when it's like in reality, you're actually completely on the right path. It's more of like, these are expectations, but it goes back to, I always say that to every single patient who comes in on either prehab or day one is, it is, I've seen people get back in 9 months. I've seen people get back in 15 months. I
Mhm.
don't know where you will fall, but just know that if you fall within that timeline, it's completely normal.
Mhm.
And it's your journey. It is not anybody else's. I don't care if somebody got back in 6 months or 10 months. This is your specific process, and we need to make sure that they're aware of that so that they know going in, okay, this is normal. I'm at 6 months. I'm not supposed to be back,
Right.
because it really, I've seen that really affect people in such a negative way. And it's such a, I just feel bad because it's like, I wish I would have been able to educate or at least provide some sort of guidance earlier in so that they knew that this is what the, expectation was. And I see that as well with like the return to running process as well, where every protocol I've seen, it's like, the 12-week mark, but most people are 4 months, 5 months, sometimes even 6 months, depending on the complexity of the surgery. And just knowing again, like, this is your individual journey, and really trying to highlight that is what I try to do to try to help mitigate that process from occurring. But yeah, I really like that you touched on that. Um, but yeah, so I guess we could probably go on. We're gonna have to bring you on for another one because this is incredible. This is so we could get into so many different topics and diving into your specifics of research even more as well, because this is going to provide so much value to our listeners, and just other clinicians. I think that this is amazing. But what would you say, just to kind of conclude things, like, I know you've talked a lot about, I'm sure it's probably hard to narrow it down, but what would you say is like the most important piece of advice that you would probably give somebody right now that is navigating the challenges of the ACL rehab process?
That is a tremendously hard question. Um, you know, honestly, I think I think you just provided fantastic advice, and that is understanding that it is a very individual journey that is influenced by so many things. And, you know, doing your best to access appropriate coping strategies that help you and help you throughout this recovery process. And, when I think back to being an athlete, I think when I was going through my ACL reconstruction, I just felt really down about it a lot. I kind of had this negative outlook. It felt like this big, really difficult thing. And I wish I just had a little bit more of a positive attitude every day when I went into rehabilitation. And, I think it's scary because you don't know what's on the other side of that. And so now I can look back and see like, oh, I returned to sport better than I was when I got injured. But I wish I had approached that with a little bit more of a positive attitude. And I wish I had um, really utilized my support system throughout that time because I don't think I did that well and I felt very isolated. And you can feel that way if you're going through this type of injury and all of your friends are on your sports team or are athletes and they're all continuing to play. It can feel like this isolating experience. So I think identifying positive ways to cope with that and kind of approach that recovery one day at a time and understand that this is your specific journey that you can't really compare to anybody else's is important. But by setting those goals and working with the resources you have and the clinicians around you, one day at a time you'll get better and it feels like a long time, but if you really put yourself into that, you'll get there.
I think that's wonderful advice. I mean, for really any injury, but yeah, stacking those small wins is critical.
Mhm.
When obviously the big goal at the end is always on our mind, I think at least breaking it down and stacking the small wins is always a really nice, way to go about it for sure. Well, with that, we'll conclude this episode. We will definitely have to have you on for another one,
Yeah, yeah, sounds great.
because this has been really awesome. So we definitely appreciate you taking the time to meeting with us and hopping on, because I think this is going to be extremely valuable to anybody that listens to this episode. So thank you again, Frankie.
Absolutely.
Thank you
Yeah. Thank
so
you guys so
much.
much for having me.